My name is Duncan Fisher, and I am a researcher in the Centre for Care at the University of Sheffield. My research is all about care, and more specifically about social care for adults. I'm going to talk about this important issue, which affects all our lives, in this video. So, what is care? Let's start with this question, a big, broad one, because care is many different things. If I care about something, or care for someone, what might that involve? We might think of thoughts or actions, like looking out for someone, paying close attention and consideration to them, or helping them in their daily life. Care can, but doesn't always, include supporting someone with something they may not be able to, or struggle to do, on their own. Caring involves thought, effort and work and time, and this can vary depending on the context. How much someone cares, and whether they do care, are political and moral issues. Care is often thought of as a relationship between individuals, such as friends or family members, but we can also think of the care of, for example, groups, organisations, or institutions. Who or what are some of the things or people that you care for or care about? Let's look at an example of care in the media. This story is about the club and fans of Millwall Football Club caring for the local community by supporting a food bank. The food bank is on the stadium site. The club runs free coffee mornings, and supporters bring food bank donations on match days. Although their fans sing "No one likes us, we don't care," this example shows a different side to the club and its fans. If we think about care as a relationship, then we can think about the direction of care between different actors, including the power dynamics. We can also direct care towards ourselves, and self-care is something we seem to be hearing about more these days. In particular, what steps we can take to maintain good mental health. Any excuse for some pictures of cute cats and dogs. Of course, we can care for pets, for animals, and for flowers, plants, trees, and wildlife in general. Caring for and about the environment and the future of the planet is another key way in which care happens. So then, what is social care? Social care is a narrower form of care, and here I will focus on social care for adults. Social care is care and support people access in order to live their daily lives. This could be because they have care needs related to a disability they may have, for example, a physical or sensory impairment, a long-term health condition, or a mental health condition. Social care brings emotional benefits and supports independence and dignity. It can involve different types of support. For example, help with dressing or cooking meals, support to get to work or social activities, or care for someone who lives in a care home. It is different from healthcare, but the two are closely connected. The National Health Service, the NHS, delivers universal health care which is free at the point of delivery. With social care, people may pay for their own care, known as self-funders, or they may get support from the local authority to pay for their care. How much support they get depends on their income and savings and on their care needs. Although social care is often associated with care services, it is millions of unpaid carers, friends and family, who take on most of this care and support work. There are currently almost 5 million unpaid carers in England, and around 20% of under 18s are estimated to provide care, known as young carers. An example that shows the connections between health and social care is what is known as delayed hospital discharge, or bed blocking. This is where someone who is in hospital is medically fit to leave, but this can't happen. This can be due to a lack of available social care support for them, which is connected to funding problems and a serious shortage of social care workers. Although social care has had increasing media attention, particularly during the coronavirus pandemic, it still does not get as much media or public attention as the NHS. When it is talked about, it is often negative news stories or ones about how social care impacts, usually negatively, on the NHS, e.g. with the bed blocking example. However, people who draw on social care and people who work in social care are critical of this narrative and the term bed blocking, as they argue that care is about people and not beds, or the number of beds that are or are not available. These stories largely ignore the potential of social care to support people to live the life of their choosing, and they frame it as a sector in crisis that comes second to the NHS. Social care and sociology. Social care is important when thinking about a number of sociological questions, including around work, family, and social inequalities. I will now talk briefly about two key issues in social care to bring these sociological questions to life. These examples touch on and connect with other forms of care, including childcare. Paid social care work. I recently did some research with young people in North East England who were paid social care workers. Overall, their working conditions were poor. Their pay was very low, their workplaces were understaffed, and they were often not given the training and support they needed. On the other hand, they all spoke positively about their work, about the bonds and relationships they had with the people they supported, and about what they had learned through caring. The problems with care work, like the low pay, particularly affect those who do the work, and this is work that is usually done by women. 82% of adult social care workers in England are women. Care work contributes to social inequality, in this case to gender inequality, and the low pay women receive for doing paid care work is an important element of the gender pay gap. Global care chains. The American sociologist Arlie Russell Hochschild came up with the term global care chain to show how paid and unpaid care work is at the centre of other inequalities beyond gender. Global care chains are the series of personal links between people across the globe based on the paid or unpaid work of caring. An example would be of a woman in a wealthy country like the United States with enough money to employ a worker from a poorer country like neighbouring Mexico to care for her children. This would allow the American woman to do paid work, while the Mexican woman would likely rely on her earnings to support family back in Mexico. The previous example showed how care work drives gender inequalities, and this example shows how class, race and ethnicity and migration shape different women's experiences of care. Thanks for listening to me ramble on. I hope you have learned something new about care and its importance to all our lives, to society and to sociology. I'll finish with a quote from a recent Oxfam report into how we talk about care. Thanks again and good luck. Every day Across the UK, the work of paid and unpaid carers helps hold society together. It's the invisible network of support, empathy and care for the people who need it most that supports our social and economic foundations. If these issues affect you, or you want to know more about them, these organisations can provide information and advice. Carers UK, Carers Trust. For more information about the Centre for Care, please go to our website.